Okay, I think we're just about ready here. There's still a few more people who are coming in, but we can probably get started. Got a pretty good group here. Thank you for joining us for this morning's webinar, Friday webinar in the Division of Epidemiology and Community Health. My name is Mark Pereira. I'm introducing our speakers and special guests today. So Dr. Jamie Stang is an associate professor in our division here in Epidemiology and Community Health. She's a leader in maternal and child health nutrition, and her interests include nutrition and weight status in pregnancy, child and adolescent nutrition, behavioral counseling and child obesity, and obesity among women of childbearing age. She's the principal investigator on several training grants, and these are funded by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. She has a maternal and child health training grant, which is called the Public Health Nutrition Training Grant, as well as leadership education in maternal and child public health. And as we'll be hearing about this morning, Dr. Stang has served on the recent 2020 to 2025 Dietary Guidelines for Americans Committee. And then joining for a discussion and comments following Dr. Stang's talk, we have a special guest from Duke University, Dr. Mary Storey. She is a professor of global health and family medicine and community health at Duke. She's also the director of the Healthy Eating Research National Program funded by the Robert Wood Johnson Foundation. Prior to Duke, as many of you know, she was a longstanding faculty member in our division and made major contributions to public health nutrition and other programs, as well as serving as associate dean in our school. Dr. Storey is a leading scholar in the field of nutrition and adolescent nutrition and obesity prevention. She's a member of the National Academy of Medicine. In 2019, she received the prestigious Mickey Stunkard Lifetime Achievement Award, which recognizes individuals who've made outstanding contributions to the field of obesity throughout their careers, including scholarship, mentorship, and education. So I'll turn it over now to Dr. Stang.
Thanks, Mark. So I'm going to be starting out the conversation today talking about the Dietary Guidelines for Americans Committee, and Mary and I were asked to talk about the process more so than the actual recommendations that have come out of the committees. So just a little bit of an overview of how the Dietary Guidelines Advisory Committees function. They are really the cornerstone of all the federal nutrition programs and policies, and they really are food-based as opposed to specific nutrient-based. And the idea is that they promote overall health and they reduce chronic disease risk. And so starting in 1990, the National Nutrition Monitoring and Related Research Act mandated that they reflect the scientific evidence. And so they are jointly shepherded, if you will, by the USDA and Department of Health and Human Services every 5 years. Up until recently, they have always focused on individuals that are 2 years of age and older. But as of 2014 in the Farm Bill, where it was mandated that they also add infants and toddlers and women who are pregnant, the scope has been expanded. And so this was the first, 2020 was the first advisory committee that had very specific questions related to developing a food pattern for birth to 24 months. So the Dietary Guidelines Advisory Committee is formed under FACA, and the committee is established to provide independent science-based evidence and recommendations. So as I said, every 5 years, the USDA and HHS have this committee that will work on their scientific review, and the chartering rotates between the USDA and HHS. So the 2020 committee that I served on was administered by the USDA, and but they will work jointly to take the recommendations that we have made in the scientific report and propose some dietary guidelines for Americans. So a little bit about the process of updating them. We basically work off of existing dietary guidelines, and it really is an update. It is not a complete reformulation of all of the science. And so a committee is developed and convened. We go through the process of developing the scientific evidence and developing a final report that goes to the secretaries of HHS and USDA, and then it's out for public comment. The federal agency takes the report and the public comments, and they use that to create the dietary guidelines. So each, as I mentioned already, each edition builds upon previous dietary guidelines that have been released. So the 2020 Dietary Guidelines Advisory Committee functioned a little bit different than it has in the past. So I'll go a little bit through our sort of timeline. In 2018, USDA and HHS posted topics and questions for public comment. And this is the first time that the Dietary Guidelines Advisory Committee has actually been given predetermined questions. In the past, and I think Mary will talk about this later, they came up with specific topics and questions that they would answer. In our case, our committee was given a list of questions that we were mandated to answer, and we were told that these were the limits. We weren't able to add anything, and we could only reduce the number of questions that we answered if we had run out of time, which, as I talk about, you'll see that we didn't have time to answer all of the questions that were put forth to us. So that year they started the public call for nominations. In 2019, in March, the committee was appointed and held the first meeting. And we started about a 15 to 18 month process of developing the scientific report. We had 2 meetings, one in July, one in October, where we met as a committee, but we also had live oral testimony from the public. And then 2 additional meetings where they were actually held sort of non-traditionally. In January, we had a meeting in Houston. Typically, they're held in the DC area, but they decided they wanted to hold one of the public meetings outside of DC to gather input from a wider audience. And then in March, we held our first online meeting because of COVID restrictions. So in June, we had a final meeting to discuss the draft report and submitted the final report to USDA and HHS. And then you will see that in July 15th of 2020, the publication was actually out. And so the organization of the Dietary Guidelines Advisory Committee for 2020, we had 6 subcommittees that worked and 1 cross-cutting group. Committees are listed here. You can see that 2 of the subcommittees were specific to the new mandate of pregnancy and lactation and birth to 24 months. And then we had additional subcommittees that worked on the questions that had been posed. And then finally, there's an overarching committee, the Data Analysis and Food Pattern Modeling Committee. I was fortunate enough to get to work on pregnancy and lactation, and then also on the cross-cutting, the Data Analysis and Food Pattern Modeling work group. So there are 3 approaches to examining the evidence that they use for the dietary guidelines. They use data analysis, food pattern modeling, and then systematic reviews, which are done with a process called NESR, and it is a USDA derived systematic review process. So we could use any or all of these methods for each of the questions that were posed to the committee. So the data analysis piece is actually analyzing national data sets. We did not use data from individual studies. The way that the dietary guidelines are set up, it needs to be nationally representative data. And so it was things like NHANES and PRAMS and BRFSS and a lot of the other very common data sources that you think of that are federal data. The food pattern modeling is actually a series of analyses that are done to model how different changes in dietary patterns might affect either meeting nutrient needs or chronic disease risk in the US population as a whole. And then the Nesser systematic review was pretty much what it sounds like. It's a systematic review of evidence with some very specific ways of looking at the evidence. And all of the background on the methods is in the report if anybody's interested in seeing that. So as I mentioned, in 2020, we were actually given the questions that we could answer. And so when the committee convened for the first time, part of that was figuring out which questions went to which subcommittees. And then a protocol was developed for each of the questions before we answered it. For the first time also, as part of the process, we posted our draft protocols online and had public comments that were given to the committee, and then the committee had to meet and go through them for each of the subcommittees and sort of work out any issues that came up before we could finalize the protocol and actually start either the analysis or the systematic review. So the committee as a whole made all of the decisions about which approaches we used to answer any of the questions. And then we did have USDA and HHS staff that implemented these approaches. And I believe at one time we were told we had about 65 to 68 staff who were supporting all of the systematic reviews and the food pattern modeling and data analysis. And so then the final protocols and draft conclusion statements were posted and as were available for review. So the committee looked at more than 62,000 public comments, and these were just the written ones, not including the oral comments that were made. And these came in between March of 2019 and June of 2020. And so all of the public comments are available for people to see at regulations.gov. And there is also a summary of all of the public comments that is included at the end of our report. So in terms of what we actually did as a committee, we analyzed, or we actually conducted about 150 analyses of federal data sets to look at the dietary intake data, nutrient intake data, and other pieces that we could get from some of the federal data. We did food pattern modeling exercises to look at which food patterns were going to meet the needs of the general population, and that was for 2 years of age and older. And then for the first time, the committee actually tried to develop food patterns for infants and toddlers between the ages of 6 months and 24 months of life. We were successful in developing a draft food pattern for 12 to 24 months of life, but the 6 to 12 month of life period proved to be a little too difficult given the limitations of the data we had and given the time frame that we had. And so that is a piece that we worked on, but weren't actually not able to complete. And then with the Nesser, you can see that there were more than 270,000 citations screened. About 1,500 were actually reviewed, and there was a total of 33 systematic reviews that were completed. So the committee's work ended in the publication of our advisory committee report, and that was posted on July 15th. And right now it is still just an online document. There will be print versions available at the beginning of next year. So the scientific report is actually pulled into 6 different sections, and this is just an overview of those. Part D is the piece that I think most people focus on, and that is actually the outcomes of the analyses and the food pattern modeling and systematic reviews that we conducted. And so you can see that in Part D, there are 14 chapters that start out with sort of an overview of what we know about dietary intake across the life course in the US. We go into pregnancy and lactation, birth to 24 months, and then the final chapters are more around diet and health relationships. And again, These were questions that were given to us. So while many of them are very important questions, there are some I think that the committee would love to have been able to answer, and they were just outside the scope of what we were allowed to do. And then finally, there's a future directions section, and there are appendices. And there is some online only supplementary material. So all of the data analysis is there, the food pattern modeling exercises that we did, including a very interesting one around redistributing the calories from added sugar to determine how that would change dietary quality. And then the systematic reviews are all included as well. So the public comment period for our report started the day that it was posted, and it closed August 13th. We did have a meeting on August 11th, and that was where USDA and HHS staff heard comments about the report itself. And then they take those comments that they gathered along with our report, and they are currently working on drafting a set of dietary guidelines that are anticipated to be out by the end of the year. So in our committee, we had a few major themes. Some of the themes that I think were very much at the forefront of every discussion that happened in every subcommittee were using a life stage approach. So really talking about healthy eating at each life stage, and as well as the cumulative effects on health over the lifespan. And then we had many discussions around the fact that this was focused on dietary patterns, not specific food groups or not specific nutrients, but patterns as a whole, and really talking about how we can support those, the recommendations that we came up with. So I'll just give a very brief overview of some of the main findings. Again, it's an 850-page report, so I can't go through all of the findings. But for the current intake, so this was answered with data analysis methods. Really the dietary intake hasn't changed much over time. And, you know, it's the same message we've been hearing for a while. Americans overconsume energy, saturated fats, sodium, and added sugars. And for some consumers, they overconsume alcohol. And then intakes of fruits, vegetables, and whole grains are considerably lower than recommended. And for Americans 1 year of age and older, there's pretty much an across the board underconsumption of vitamin D, calcium, dietary fiber, and potassium. When you look at the healthy eating index of the dietary intake of Americans, you can see that on a scale of 0 to 100, we come in at about a 59. Dietary intake is actually best at both tail ends of the lifespan, so 2 to 5 years of age and 65 and over. We did not calculate an HEI score for individuals under 2 years of age, so that data isn't available here. In terms of the pregnancy, the first chapter on pregnancy, we did look at different food patterns and determined that the 3 existing patterns that were developed in the 2015 dietary guidelines, so that being the healthy US pattern, the healthy vegetarian pattern, and the healthy Mediterranean style pattern, that should meet the needs of most pregnant women, with the exception of a few nutrients, namely choline, iron, vitamin D, and vitamin E. There was a lot of discussion in the chapter about achieving a healthy weight prior to pregnancy and striving for weight gain within the recommendations. Iron supplementation is needed by many women. Folic acid supplementation should begin prior to conception. And then we had 7 strategies for women of reproductive age. So not necessarily always just during pregnancy, but women who were capable of becoming pregnant. And that was around achieving a healthy weight, following one of the 3 dietary patterns, not restricting foods that are potentially allergic unless women themselves are allergic to the food. So there's no need to restrict during pregnancy. Seafood intake should be encouraged. Alcohol should not be consumed in pregnancy. and we reiterated the food safety principles of the 2015 committee. With lactation, there was a lot of discussion around, again, the 3 dietary patterns should meet most of the needs. A big push for seafood consumption during lactation to encourage proper fatty acid intake. And then looking at a few nutrients of concern: choline, magnesium, protein, fiber, vitamins A, D, and E. Very strong recommendation to discontinue prenatal iron supplements during lactation unless they're medically indicated, because the levels are just much too high for lactation. There's no need to avoid potential allergens unless women themselves are allergic. And again, we recommended that they support the evidence from 2015 on alcohol and caffeine consumption and encourage a healthy weight. In chapters 4 and 5 around infant nutrition, a lot around encouraging breastfeeding. And then the complementary food and beverage introduction was a new piece. Really discussed not needing to introduce any solid foods before 4 months of age. And the literature did not support any differences in terms of introducing solids starting at 4 to 5 months of age as compared to at 6 months of age. So either any of the time frame between 4 and 6 months of age seems to be appropriate, at least according to the literature that we reviewed. One of the big recommendations is to assure that we provide foods that are high in iron and zinc, particularly for infants who are breastfed exclusively from 6 to 12 months of age. And actually, one of the pieces that isn't in here, but we actually found relatively high zinc intakes in infants who were taking infant formula and also getting foods that were high in iron and zinc. And so if you're interested in that, there's a big discussion on that in the chapter. And then avoiding sugar sweetened beverages for children under the age of 2. We have a specific chapter on infants and food allergies. That was a very big discussion topic for the committee. And the evidence was quite strong that introducing peanut and egg in the first year of life, so between 6 and 12 months of age, was recommended, and it should be done after other complementary foods and beverages are introduced. And again, there's no evidence to say that women should avoid potentially allergenic foods unless they need to for their own health. And in terms of supplementation, routine iron supplementation of all breastfed infants may not be advisable, specifically after 6 months of age, because if infants are getting iron-rich or iron-fortified complementary foods, they probably don't need it. And there's no basis for recommending vitamin D supplementation above the 400 international units a day during infancy. In terms of children, the food patterns for children, as I mentioned, we weren't able to come up with a food pattern for the 6 to 12-month-olds. By the time you take into account all the different combinations of human milk and infant formula, and then you start adding in all of the other factors on that, we just really did not have adequate time to do that. So the recommendation is there to take what we've done and build on that between our scientific committee and the next one, so that they will be able to take a look at the evidence and hopefully build out some patterns for those 6 to 12-month-olds. In terms of for toddlers 12 to 24 months old, we did come up with a draft pattern. And there was, I think, probably one of the biggest pieces that people were surprised by was how much we encourage seafood intake. And again, there's a big push to avoid foods and beverages with added sugar. The Dietary Patterns Committee, this is a busy slide. I'll just say that they looked at all-cause mortality and then specific types of disease outcomes. Fruits and vegetables, whole grains, legumes, nuts all come out as protective against most risks. And then there were some food categories that seem to come out as relatively high risk if they're consumed frequently. And those were red meat, processed meats, animal source fats, sugar sweetened beverages and foods, and then refined grains. The Dietary Patterns Committee looked at various dietary patterns, and we decided that there were so many different patterns with so many different names that had some commonalities that it was more important to focus less on the name of a dietary pattern and focus more on the constituents of that pattern. And so those patterns that are beneficial included higher intakes of fruits, vegetables, legumes, whole grains, lower no-fat dairy, lean meat and poultry, seafood, nuts, and unsaturated vegetable oil. And they also had low consumption of red and processed meats, sugar-sweetened foods and beverages, and refined grains. There was a committee on dietary fats and seafood. They reiterated that an intake of saturated fat should be less than 10% of energy, and that dietary cholesterol intake should be as low as possible. The seafood group, we really focused a lot on children in particular, because what we see is children don't eat a lot of seafood, and then that continues throughout the life course. And so the idea is that by introducing seafood early to children, hopefully we can help them grow into seafood consumers. And so 2 or more servings of seafood per week, which comes out to the 8 to 12 ounces per week, which is the recommendation that had come in previous dietary guidelines, is what we reiterated. And there was more emphasis on seafood in the birth to 24-month committee, and particularly that food pattern of 12 to 24 months. And then for children who don't consume seafood, or adults for that matter, there are a variety of other foods that they can consume to get omega-3 fatty acids. The beverage committee really wanted to reiterate that there are some beverages that have natural sugars, like milk and 100% juice, that do contribute to nutrient intakes in the diet. And so those can be included in a healthy diet, but we only recommended limited intake of sugar-sweetened beverages. And that subcommittee decided that low and no calorie sweetened beverages may be useful in weight management in adults. The alcohol committee reiterated that if you drink, you should do so in moderation. And there was a strong mantra in that group that people shouldn't drink because they think it makes them healthier, that red wine is not necessarily going to cure all your ills. And so beginning drinking because you think it's going to prevent a disease is not necessarily supported by the literature. If you do drink alcohol, do it in moderation. And they actually suggested no more than 1 drink per day for both men and women. And if you look at the data for women, it's actually less than 1 drink a day, which seems to have the best health outcomes. This is from Chapter 12, the committee that looked at added sugars. And I'm not going to walk through it except to say that there is this method that they use for determining how many grams of added sugar and added solid fat you can have in the diet, and then that is used to determine the percent of added sugars in the diet. And so based on the table that I just put up briefly, you can see that the recommendation is that no more than 6% of energy in a diet come from added sugars. And that is to try to achieve the best nutrition that you can while avoiding excess energy intake. And if this is an interest, there's actually, if you go to the supplementary material, there's actually a food modeling exercise that we did. I think it's model 2 in the supplementary material, where we took the added sugars calories and redistributed them across different food groups by age and gender to determine how we could improve the diet by actually redistributing those extra calories. And then finally, Chapter 14 on the food patterns, we looked at, this is just for 2 and older. We recommended that we continue the recommendations from previous committees around the healthy US style diet, the healthy vegetarian diet, and the healthy Mediterranean style diet. And again, there are some core components of all 3 of these food patterns, very similar to what I had talked about from the subcommittee work. And there was a lot of discussion about helping the public continue to shift their dietary intakes in directions that not only include getting all of the food groups and as many nutrients as possible, but also with an increased focus on energy balance. And so I know that this particular set of seminars has talked a lot about diversity and equity and inclusivity. And while that was not specifically part of the questions we were given to answer, I pulled out a few of the quotes from the report here so that you can see what this is like. So you can see that we talked a little bit in the overarching discussion section about dietary patterns and how to incorporate foods consistent with cultural preferences and socioeconomic factors. And then we also had an overarching discussion about the importance of food access in a healthy dietary pattern. Again, because of the type of food pattern modeling we do, we don't model specific racial or ethnic or cultural food patterns. That's more menu modeling than the food modeling, which we use. But that is sort of the next step, would be to take these broad food patterns that are there, and they can be modeled with menu modeling to make them culturally specific or within economic parameters, how those can best be met. And then in the future direction section, we have a review of public health strategies to support promoting dietary quality, and really talking about some of the marketing of food and advertising and other pieces, sort of the contextual factors that influence how and what people eat. We ask that future committees broadly consider diverse populations. And this was, I think if you go through the individual subcommittee sections, you will see that almost every subcommittee has a limit in terms of their limitations or a recommendation to increase the diversity of individuals that are in studies, because in many cases, we are working with a predominantly upper income, white, middle class group of individuals, and whether or not we can actually take those those findings and put them into broad-based recommendations that meet the needs of our very diverse US population is questionable. And then finally, really to look at food security status and income more closely in future committees. All right, so I will let Mary talk a little bit about her experience and on her committee and how that may or may not have been similar to what I've been talking about.
Thank you, Jamie. And I'm just really pleased to be here. I really miss being in the division and in the School of Public Health. Jamie, I thought that your committee came out with an incredibly scientifically sound report. I thought it was really well done. What I want to do is to give my perspective of the dietary guidelines and my experience being on the 2015 Dietary Guidelines Committee and how I think the process can be improved. We had in our committee, I think, 3 important changes in the 2015 DGAs. For the first time ever, our committee proposed quantitative limits on added sugars. Before that, the recommendation was eat sugar in moderation, and who knows what that means. So we had recommended no more than 10% of calories from added sugars, and this was even strengthened in the current recommendations to 6% or less. Also, I thought what was important in the 2015 report was that for the first time, we looked at the food environment and settings that influenced food availability, food access and intake, and how neighborhoods, especially low-income neighborhoods, how they're influenced by lack of access to healthy foods, and looked at the impact of weight and diet quality. And I think looking at the food environment settings, and we also had looked at schools, early care and education, work site settings. So they were place-based settings, and how that really impacted on food intake and weight. This is really especially important to address the disparity gaps that we see in ethnic racial populations as well as rural urban areas. Now, we could do this, we could have a focus on the food environment and settings because our committee chose the topics that we thought were really important. USDA and HHS had nothing really to do with that. Jamie's committee in the 2020 committee, as Jamie said, they were given predetermined questions that they could not change. And unfortunately, the food environment was not included at all in any of the questions. So I think in the future, with more attention now on health equity, as well as populations of color and face and low-income populations face disproportionate incidences and prevalence of chronic diseases. And COVID is even shedding a greater light on the urgency to address diet-related chronic diseases. In New York City, their data showed that obesity, if you were obese, it increased 4.3-fold higher odds of hospitalization. If you had severe obesity, you had 6.2-fold higher odds of being hospitalized. And with diabetes, it was 2.8-fold higher rates. And again, we see higher rates with COVID among low-income and populations of color. So I think the next dietary guidelines really has to have a focus on disparities in health equity. The third, I think, important change in our report was that we said Americans should eat a less resource-intensive diet, higher in plant-based food, and lower in red and processed meats. For the first time, we had a focus on diet sustainability, describing it as an essential food element of food security. We said that what's good for human health should also be good for planetary health. This was just a quote from the chapter in our report on diet and sustainability. We said an important reason for addressing sustainable diets, a new area for the Dietary Guidelines Advisory Committee, is to have alignment and consistency in dietary guidance that promotes both health and sustainability. This recognizes the significant impact of food and beverages on environmental outcomes from farm to plate to waste disposal, and therefore the need for dietary guidance to include the wider issue of sustainability. Addressing this complex challenge is essential to ensure a healthy food supply will be available for future generations. Well, what happened? This caused a ruckus in the industry, and diet and sustainability were not included in the final dietary guidelines. So what happens? Now, Jamie, the report, we spent hours and hours working on examining the evidence, doing all the work that Jamie said. For me, I know I spent about 4 hours a week over the 18 months. But what happens after the scientific report is turned in to the secretaries of USDA and Health and Human Services? Well, once it's turned in, it goes into a black box. And the scientific advisory report that's submitted, those are not the final dietary guidelines. There's no transparency on what happens after the report is turned in and the final dietary guidelines. So there's strong potential for undue political influence. Food industry lobbying groups often seek to weaken the recommendations. After our committee report was released, it was immediately slammed by the livestock industry, unhappy over our suggestion that a plant-based diet was both healthier for Americans and more sustainable. The North American Meat Institute said the committee was going well beyond its scope and expertise. And the USDA and HHS secretaries said the committee had gone beyond the scope of the dietary guidelines, and they were removed from the final dietary guidelines. Further, Congress, on behalf of the secretaries, said that future dietary guidelines committees were prohibited from ever addressing diet and sustainability. You know, many other countries do have diet and sustainability. So the panel's recommendations and the report can be discarded from the final dietary guidelines. Officials from USDA and HHS make the final selections. The current Agriculture Secretary from USDA, Sonny Perdue, has spent much of his career in agribusiness, and he really has the ultimate say over the final content in, as well as the HHS Secretary. So seeing already the 2020 report is seeing backlash by the food industry lobbying groups such as the American Beverage Association and the National Confectioners Association, wanting to keep the current 10% limit on added sugars and not the 6%. So I think going forward, there needs to be much more transparency in the process for deciding the questions the committee will answer, how they select the committee. There's a lot of concern over conflict of interests in committees, as well as the final dietary guidelines and how they're, what is actually in them. Most of the time, I think the committee, the report, the scientific report is really taken, most of it is taken into the dietary guidelines, but as I said, with diet and sustainability, it was removed entirely, and there is undue political pressure from lobbying groups from food industry. So I think going forward, the dietary guidelines need to be more transparent as far as what happens when the scientific report goes in, and also taken out of USDA and HHS. I think they should be, the report should be really done by an independent group like the National Academy of Medicine to really develop and to be able, right now, it's really not known how the members are even selected. And so I think transparency is even more important, and that there needs to be in the next revision, much more focus on disparities, and not just what Americans should eat, but what are effective solutions, what are effective strategies and interventions. And we know people pretty much know what they should eat, but you know, we have a very sick population as a whole. And so I think looking more at what are effective strategies and interventions, especially for populations of color and low-income Americans, are really urgently needed. And so I think, Mark, we have 15 minutes for discussion, and I would love to hear people's comments.
Thank you for the excellent presentations. Yeah, we do have plenty of time. People can type their questions into the chat box and we can read them. I don't know if Jeff is still on, but I'm not seeing the raise hand function. But we do have a question that already came in from Diane Newmark-Steiner. Very interesting. You say there is talk about addressing obesity even more in the future. Is there a discussion on how to do that? Any discussion on weight stigma can be harmful, as well as unhealthy dieting and how to avoid those things.
I agree with all that. I think the public comments are really important. When I was asked as a debriefing after the committee what I thought should change, and I said, well, we need more public comment into the questions. Our committee really decided what we thought was important. And so this year, they did change the process. So there was a public comments on what were the most important questions. But then what really shocked me was that the committee did not have any say on what those topics should be. It was really left to HHS and USDA. So I think that making sure that the public comments are included, Diane, for things like stigma and obesity is really critical.
I would agree, and I think a big piece of this, our discussion about considering weight in the future, is that the dietary guidelines shouldn't just focus on, right now when they do a lot of the data analysis and food pattern modeling, it's all about looking at the food groups, but there's very little actual guidance about what to choose within those food groups. And that's that implementation piece that Mary was talking about and that we were talking about is, so we put out, you can follow a vegetarian dietary pattern, but there are a lot of things you can choose within that pattern. And so the need to go above and beyond just putting out and saying, this is the dietary pattern you should consume, but really giving people tools and techniques for how to make the choices within that pattern that are going to be best for them. And a lot of that is the piece of the energy, the excess energy intake. And so really to have that always in the back of your mind that we want this to be, we want to make recommendations that keep energy balance and energy in the forefront.
From Aaron Folsom, the Will It Lancet report addressed sustainability. Have you thought about publishing your sustainability and equity conclusions in other forums? I was actually having a similar question in my head.
Yeah, there's a whole chapter which is publicly available in the 2015 scientific report. So that's available. I think, like Jamie said, the 2015 report was like 500 pages. The one that, the 2020 is like 800 pages. So they're not easy to find, but they're certainly available. And I think now there's just so much importance with like the Lancet report and, with sustainability that's something I think people can really advocate for in public comments, and to really get it changed. It easily could be changed to include sustainability. So I think public pressure could really make a difference.
From Tricia Alexander, I hear healthy weight is referenced quite a bit. Was there any conversation about what is meant by healthy weight and how BMI may have some limitations as an indicator of overall health? And then there's been discussions lately about BMI having its roots in somewhat of a possibly racist history, because I think it was just focused on the white Caucasian population. I think that's what she's getting at. And any discussions along those lines?
Did you want to take that, Mary, or did you want?
Yeah, well, BMI is only used as a screening tool. It's really not a measure of fatness. And I think we need better technology available to really assess body fatness, but it's really only used as a screener. Jamie, I don't know if that came up. That was not addressed at all.
It wasn't specifically in our questions. One of I think where we really saw healthy weight come out, because weight status for the most part was not an outcome we were tasked with looking at. However, when you started looking at relationships between dietary patterns and chronic disease risk, weight or BMI were always it was always in that discussion. It was in almost every article we reviewed. It was, and so this idea that, you know, I agree with Mary, BMI is not necessarily a predictor of health in and of itself. But on the other hand, we don't have a predictor. And so one of the recommendations that we do have in there is really having access to more things that can give us the kind of health data we want, like biomarker data, having biomarkers for all of the different pieces that we're looking at across the age groups, across racial and ethnic and economic diverse groups. And that is one of the big recommendations that comes out in our future piece, is some of the limitations, because again, for the most part, other than federal data sets, which are federal data sets, we can't change them, we're looking at existing literature. And so you're limited by what is available and what meets your protocols for inclusion, exclusion, whatever. And I agree that there are some big limitations in the full bodies of literature in terms of who's included, how much we can generalize, and the types of measures that we use to make some of our conclusions.
I think the evidence is very strong across all ethnic racial groups that having obesity is related to chronic disease risk, including cardiovascular disease, type 2 diabetes. And so I think the other issue is that we know that low-income communities, communities of color, have less access to healthy foods that costs more. And that's also why I think we really have to improve the whole food environment.
Okay, from, this is a really good one, I think, from Ann Wang. Can you talk a little bit more about how the predetermined questions were determined by the USDA? Do you know much about that process?
I think Jamie would probably know more. You know, they did ask for public comments on the questions, and they received thousands. And Jamie, I don't know if they gave any explanation, like why didn't they choose ultra-processed foods, which is now a really area of growing attention. It'd be really important to look at the impact of ultra-processed foods on health and weight. And also processed foods also was not, highly processed meats were also not included as one of the questions, nor was sodium. Sodium, they said they were going to adapt the National Academy of Medicine standards, but you know, there were no sodium questions either.
Yeah, when we started the process and we sort of had our first meetings and we were given the questions, there was some discussion about, well, where did these questions come up with, and why are there certain questions here which didn't seem to be the highest priority to members of the committee, and why were others missing? Not a lot of explanation given. As Mary said, there's not always the most transparent process involved here, but what we were told is that the questions came from the USDA and HHS, from groups, from both of those groups that put their topics together and came up with a list of what they considered to be priorities. How that became the priority list, aside from the B24, which is mandated in the Farm Bill, so we knew why there was such a big emphasis on that. But above and beyond that, who was at the table when those questions were developed is something that we were not actually told as a committee.
A question from Tessa Laswell. Can you talk a little bit more about the challenge of disseminating the guidelines to lower literacy populations and lower educated populations? I actually think that there's a challenge for everybody, but especially in some of those more challenged groups in terms of understanding the concepts, especially as the guidelines are people say they're always changing. I like to look at it a little bit more positively. They're always evolving as we build on the science. But that dissemination piece.
Well, the committees, so the scientific committees, I kept wanting to go to that piece. Like as we were writing up discussion, I kept wanting to put in things about how, and we were told, no, that is what the staff do. That is what happens after we put our committee out. So as a scientific advisory committee, we don't have a lot of say in what, as Mary said earlier, what does or does not go into the final dietary guidelines, and then how those actually get disseminated, whether it be graphics or materials. I do think, though, that we had a lot of discussion about this, and this idea that as Mary said, just telling somebody to have, that you should limit your sugar intake is not helpful. And for that matter, do people really understand what 6% of their caloric intake or their energy intake from sugar is? And so there needs to be, that's that translational piece of taking the evidence and breaking it down into really concrete, manageable steps that people understand, something that they can actually go to a grocery store, or they can read a label, they can go into a school cafeteria and actually figure out what it is that fits within their within the guidelines. And that translational piece is something that unfortunately the advisory committees don't get input into. I don't know if you have anything to add, Mary?
No, I totally agree.
From Alyssa Doherty, as you mentioned, public support is an important voice for supporting inclusion of diet and sustainability in the guidelines. Do you have any thoughts on how health professionals could influence the public to voice their support more for some of these things?
Yeah, when they decide, when they put out options for public comment, make comments. And I will tell you that, if you look through the comments that we have like 62,000 of them that we looked through, they do get looked at, they do get considered. And as, I think the more support there is for transparency in the process, for somebody outside of USDA and HHS, if they truly are going to give questions to the committees, that there be an independent body that gets to help determine those. I think that could help reduce some of the influence of industry, and maybe, agriculture has their programs that they want to support. HHS has things they want to support. So having people really demand that this be a more transparent process, and having that, taking advantage of those public comment periods.
Those public comments are really important, because on the comments were just due recently for the scientific report, but 68% of the comments were from food industry. So it's really important for people. I think there'll be open comment periods. Jamie, I'm sure you can send that around the school, and I think APHA and a lot of other associations will, I think, also have petitions and have really have forums for making the dietary guidelines better.
Right, so I think we want to get the message out more about the public comments. We can do that through social media. We can do it through writing editorials in the lay press. Those are some ideas.
Good. Op-eds.
Right. Any other final questions from the audience? We're just about approaching the hour, but we could take another one or two if people wanted to stay on, but looks like we might be wrapping up. Was there anything else that you wanted to leave us with, Jamie or Mary?
Just that the dietary guidelines are so important. I mean, they serve as the basis for what foods are served in schools, childcare centers, what's in the WIC food package, what dietary advice health providers give. So I think that they're just critical, I think, and we need to take them to a different level of really looking at solutions and strategies. And those solutions and strategies are going to be different among, different ethnic and racial groups, income, literacy, and there's not just one size fits all.
I agree. And I think, the dietary guidelines are, they are really the cornerstone. I mean, everybody says that, and it's true. There are limitations and they need to be acknowledged. But I think on the other hand, you can go on, like, as I said, we can do food pattern modeling. We couldn't do the menu modeling, but that doesn't mean that there can't be concerted efforts to push for that on, for USDA and HHS to go beyond and start doing some of this cultural tailoring, some of this economic tailoring, to really dive deeper into the needs of specific subpopulations and the context. We kept saying context, context, context. It's not just telling people what to eat, it's engaging them and really making sure that they're able to take this advice and actually go out and implement it. And that's, we need to push for more work in that area.
And I would just like to end, Mark, by saying that I think this report is really scientifically, very sound. The committee really did a good job within the limits of what they were allowed to do.
Yeah, thank you, Jamie, and all your colleagues who worked tirelessly on this. And I want to agree with the final comment from Diana Mark-Steiner, which is to really thank both of you for all your work on the guidelines over many years and for sharing it with us today. And then I want to close with an announcement for next week, which is going to be a really important webinar we're having. It's racism as a public health issue, a legislator's perspective. So we're having a local representative talk to us about that, Ruth Richardson. So we hope to see you next Friday. Thank you, everybody. Have a good weekend.
Bye.
Thanks.